Our main reason is basically to provide accessible healthcare services for people within the underserved communities, just like where we are. We observe that most of them, due to financial constraints, they couldn't access good and adequate healthcare service. So we felt there's a need to, bridge the gap to provide, what we can do as a foundation in line with Goal 3 of the Sustainable Development Goals, which focus on healthcare and well-being. Yeah. Okay, we have overseas communities. We have people from Ijoga, we have people from Ishaga, we have people from Imashai, and we equally have people, a lot of people from Iboro. In fact, we have some people who, came from Igbogila just to take part of this great opportunity.
Are you happy with the turnout?
Okay, as a matter of fact, this is our second edition, and with the look of things, it's quite obvious that people within this community are already used to the services we provide in area of health. So it's a great thing of joy for us at the foundation to have people who come from far and wide to benefit from this laudable opportunity. Looking at the we may have close to 250 people here gathered, beneficiaries exactly. As far as I'm concerned, yes, the Ogun State government, they are trying their best, but yet they need to do better. They need to do better because we've had cases of people complaining of they being referred to Federal Medical Center at Ijaye, which means that there are still, not enough health facilities present in this locality. So we felt the need, to equally, give our own helping hand. While the government are doing their own, we are equally, happy to equally render one or two, assistance to those really in need. So that's why we are here. So, and we equally want to encourage the government to equally to do more. We as private citizens, we are doing this. So we encourage the government to equally do their very best in ensuring that there is total inclusiveness in the area of health.
Yes, we actually envisage 300 number of people, but the way things are going, it's possible for overshooting numbers. Probably because we can see that our people lack medical care. Our government cannot do it all alone. The reach of government is not, but we have to cover it as an NGO. But by God's grace, we are possibly looking at overshooting number. But 300 is expected. But the way we are seeing, it's going to be more than 300. By the grace of God, we started 2-3 years ago. And then we are growing in numbers. We are a team of young professionals, doctors, accountants, scientists, and a lot of us. So we are giving back to the society. Actually, we come from this area, and we say, okay, this is where we came from, so we can actually give back to the people. So the next 2-3 years, we are looking at encompassing the whole of the Yewa, both the Ogun West in general, by God's grace.
My name is Mazida Abanigbe. I am the project director of Adebiyi Habib Foundation. I'm a lawyer, and we are here today for medical outreach because we decided to reach out to communities, selected communities in Yewa North local government to provide medical services and medical attention to them. Our major motivation is to give back to the community, and we have itemized Sustainable Development Goal 3 and Goal 4, which is related to health, and the medical outreach is to check their medical welfare and to provide them with the required things to solve the situation, to make them better. As you can already tell, it is very strategic that we selected the communities around in Yewa North local government, places like Ijoga, Ijoga, Imashai, Sunwa, and the environs. We decided to come here to do this because we know that provisions made here is not adequate, which is the reason why we have decided to come here to fill in the space as much as we can. And we hope that the government is also going to, pay attention to these communities, because these communities need the attention. The same thing that our government should do. We expect that, for instance, I believe there should be a medical center where this need should be catered for. There should be medical personnel around in Yewa North local government. I mean, a working system where they can work in and seek medical solutions to any issues that arise with them. So I believe we can look into this area. We believe the government can look more into this area, provide the necessary facilities so they can easily, have it accessible, because this is us coming to them, because it is not easily accessible. So if we come to them, if the government can come to them just like we did constantly, we believe that these areas are going to be filled properly.